Dr. Fonseca. Have there been any recent developments in myeloma treatment and research that make you hopeful?
Absolutely. And I would say that the one area of work that makes me most hopeful is what we're seeing with immunotherapy. And we have seen that both at, the ASH meeting as well as the ASCO meeting. And this year where people are presenting updates with the various clinical trials with either bispecific antibodies or CAR T-cell therapy as a new avenue for the treatment of myeloma. In fact, at the last ASH meeting, we had 14 presentations of different compounds or different constructs that are active. So, I think that the future is bright in that regard. We're seeing their application right now. And, a lot of these updates also have been made at ASCO. We're seeing the update of, the treatment of patients with fairly advanced and aggressive disease, where we can still show very significant responses. I participate in some of these trials. I can tell you, in my institution, using some of the bispecifics, I see patients who have previously exhausted all other options and now are MRD negative at 10 to the -6. And if we're seeing that in the very advanced disease, I cannot wait to see what happens when we start using these treatments in either early relapse and why not in the near future as frontline part of our therapy. So I think to me, that whole field of T-cell engagers, whether it's bispecifics or the CAR T-cells, remains one of the most exciting areas for future research.
So how can patients stay up to date with on information like this?
I think what we alluded to before is very important to work with groups like yours and other patient support organizations that can keep them up to date. I think they're doing a very good job and also providing updates post, some of the large meetings. I know there's a lot of patients out there that are very sophisticated that will even join the medical meetings, and that happens with some frequency that they want to learn. And patients that go and ask me details about the statistics of the trial. So that's a whole spectrum, right? But at the minimum, I would say a strong connection with a support group or a patient, support organization becomes an imperative as you deal with this. And also that would help you because, there's with this whole concept of, the information not always being completely truthful, that can be scary as well too. If someone goes and just looks for, I would say even sort of the resources that are out there in a textbook today, well, just keep in mind that textbook was probably written 5 years ago and it represents the studies of about 10 and 15 years ago. How that relates to you, it's very distant. So it is because of this continuous process of research that we know better what's going on at the present time.